Hi, I'm Rebecca Ruid, and I'm a pediatric psychologist with the Vermont Continence Project. We're based at the Center on Disability and Community Inclusion at the University of Vermont. Our topic today is stepping out of power struggles. Inspirational speaker Alexander Don Heyer is quoted as saying, "When a flower doesn't bloom, you fix the environment in which it grows, not the flower." For some reason, when we consider gardening or other such tasks, we most often look at changes we can make that are within our control, rather than trying to manage things outside of our control. Yet when it comes to parenting and tasks such as toileting, we so often try to control the uncontrollable. This presentation is aimed at helping you refocus on aspects of your child's toileting journey that are within your control, rather than spending time on those that are not. In doing this, you will not only likely find greater success, but also decrease power struggles. A power struggle is when two or more people fight for control. All living sentient beings are born with a temperament. They describe the way that we approach and react to the world. Temperaments are biologically based and relatively stable over time. There are three basic temperamental styles. The easier flexible temperament is adaptable, calm, predictable, and not easily upset. Active or feisty temperamental styles are often fussy, react strongly to new situations, changes, and people. They're also easily upset and overwhelmed, and they are intense in their reactions oftentimes. The slow to warm up or cautious temperamental style is also often fussy, but generally less active, and somebody with this style takes a little bit more time to try new things. Think about yourself. What is your temperamental style? What is your child's style? Does it align with yours, or are they different? How may knowing your temperamental styles, and whether they match or not, impact your view of your child and interactions with your child? Feel free to pause the video to consider these questions. Though we noted that temperamental styles are biologically based and somewhat stable, they do interact with outside influences. Temperament plus environment equals personality. Caregivers don't control 50% or more of that equation, but do control a great deal of the environment. So let's focus on that. You may be wondering, what does temperament have to do with power struggles? If your child is easy or flexible, the toileting journey most likely poses a low risk of having a power struggle, and the toileting process is likely to go relatively smoothly if there are no medical concerns. These children are often motivated by intrinsic rewards and are eager to master this new life skill. It's still important that your child has engaged in toilet learning and is demonstrating the readiness skills, as this is important regardless of temperamental style. Make sure to refer to our toilet teaching and readiness handout and video if you've not already reviewed this. Whatever your temperament type, things are probably going to go just fine with this type of kiddo. If your child is slow to warm up or cautious, your child might need a more thoughtful approach to toileting. Inch stones may need to be smaller than for a child that is easy and flexible, and understanding that progress may be slower is important. For a reminder about inch stones, please see our handout and video on inch stones. Routine is helpful for these kiddos, so it's important that you establish and maintain this during toilet training and you prepare your child when there are going to be unavoidable changes. Having a child with this temperament style may also mean traveling with more supplies than you're used to. Think portable potty seat, familiar wipes. Oftentimes, cautious children may appear defiant when they're feeling anxious. If you note resistance or refusal around potty training, consider exploring if there is some fear or anxiety to better understand what might be leading to this. If you are an easy and flexible temperamental type, it's likely smooth sailing with this kiddo. You're going to tailor your approach to your child. If you have a slow to warm or cautious style, watch out for running the risk of overly accommodating and joining your child in their anxiety. If you happen to be active and feisty temperamentally, you risk losing patience for the small steps your child may be comfortable taking. If your child is active and feisty, you are at the highest risk for entering into a power struggle. It's imperative that you ensure ample time for toilet learning and readiness, and that your child is a willing participant in the training process. These kiddos are often aware of what the adult goals are and actively work against them to exert their independence and control. Ensure that your feisty child is provided with choice when possible. For example, do you want to use toilet paper or wipes? Do you want me to sit in the bathroom with you or wait just outside? Make sure you're skilled at using your own distress tolerance skills. You can see our distress tolerance handout for more information about this. If you are easy and flexible, you're probably going to respond pretty well to this type of kiddo. If you're slow to warm or cautious, you may mistake your child's power struggles for anxiety and provide your child with too much control. If you are active and feisty, you're at risk of fully engaging in a power struggle. We want to make sure when we sense a power struggle may be coming on, that we do the right thing as the caregiver. We don't want to push back, as you can see in this first image. This is a power struggle. We also don't want to let our child just take over and call all the shots. This won't feel good to you, and ultimately it won't feel good to them. We do want to meet our child with calm, clear, and consistent expectations and consequences, and hold steady. This lets children know that you are confident in their ability and in your own decision. It allows you, the adult, to remain neutral because you're refusing to participate in the power struggle. Over time, your child will know what to expect from you. When you are calm, you're better able to recognize power struggles and not engage in them. Use the distress tolerance skills and review our handout on this if necessary. Make sure you offer your child empathy and validation. Empathy is letting your child know that you understand how they feel and can relate to what that is like. This does not mean you agree with how they feel, though you may. It simply means you get it. This can be saying, I can see that you're feeling really frustrated that I expect you to put your dirty pull-up in the bag. Feeling frustrated is hard. Validation means letting them know that their feeling makes sense given how they're experiencing the situation. Again, you may not agree with how they're feeling or experiencing the situation. Validation just means that you understand their perspective. Saying something like, it makes sense that you feel frustrated because I'm telling you to do something you don't want to do. When I'm told to do something I don't want to do, I get frustrated too sometimes. Look over the readiness checklist and make sure that you aren't expecting your child to do something he or she is not yet ready to do. Review the Division of Responsibility handout and consider if you are trying to control something that is not within your control. This will be frustrating for you and for your child. Make sure you're focused on toileting tasks that are in your control and assigning the others to those that can manage other tasks. Finally, offer choice. When we have or perceive we have choice, we are less likely to engage in power struggles. Remember, a power struggle is about control, and I don't need to do this if I feel like I have control. Remember, it takes two to have a power struggle, but only one to get out of it. Hopefully, you have learned ways to avoid engaging in a power struggle with your child. If you have questions or comments, please contact us at continence-project@uvm.edu. The information contained in this video is for informational purposes only. It is not a substitute for professional health or medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider.